Welcome to the Environmental Medicine mini class. My name is Tal and I'm the Educational Director at the American Academy of Functional Health. In this class, we're going to review the impact that a few of the environmental chemicals have on our body. This class is a part of our functional medicine mini classes, and we'll take a look at how some of those chemicals that are so prevalent in our air, in our water, in our food, how they impact our endocrine function, our immune function, and how some of them can lead to cellular damage, to chronic inflammation, or contribute to autoimmune or degenerative conditions. So let's dive into it. There are thousands of environmental chemicals all around us. From the air we breathe, the food that we consume, the water we drink, and the cosmetic products that we use on our skin. In this mini class, we're going to dive into a few of those groups of environmental chemicals, and we're going to start by one of the statistics that was just published recently, a few years ago, and they found that 85 pesticides that other countries have banned are still used in the US. According to a peer-reviewed study published in the Academic Journal of Environmental Health, in 2016, the US used 322 million pounds of pesticides that were banned in the US because of safety concerns. In this picture taken from the study, you can see the list of pesticides used in the US and the pesticides that are banned in at least 2 or 3 other agricultural nations. On top, you can see the European nations, EU, the United States of America, USA, China, CAJN, and Brazil, BRA. The first column on the left gives you the name of the common pesticides. The second column indicates whether the pesticide is on the international list of concern. For example, the W indicates that the World Health Organization determined this particular chemical to be extremely or highly hazardous pesticides. The red marks means that it was banned for use for safety reasons, while the green means that it was approved in use. Notice how many of those pesticides are banned in Europe while they are approved in the United States for use. Now, there are multiple published studies that are discussing the pathophysiological changes that occurs in our body when we are exposed to those chemicals. Non-genetic factors contribute to about 90% of the risks of chronic diseases, which means that majority of the factors that are driving chronic disease are environmental, lifestyle, and dietary. Most of these factors that are leading to chronic disease, unfortunately, are not addressed by the mainstream approach and primary care. These non-genetic factors include chemical pollution through air, water, and food, inflammatory lifestyle, stress, and the use of different drugs. Now, multiple studies have reported that these chemicals contribute to harmful changes in our gut microbiome, inflammation, lipid peroxidation, and oxidative stress that are associated with damage to our cells and organs. Here's an example of studies that report that heavy metals such as lead, cadmium, and arsenic, aluminum, and mercury lead to pro-inflammatory reaction. For example, serum level of cadmium was elevated in patients with rheumatoid arthritis. So if you have patients with chronic inflammation or an autoimmune condition, it might be useful to screen them for heavy metals to determine if there is accumulation of heavy metals that could continuously drive the disease pathway. Here's another example with a study that included 9,447 participants indicated and reported that high levels of heavy metals were associated with greater levels of insulin resistance. There are multiple studies that are showing us that some of these environmental factors can contribute to dysfunctional glucose metabolism. It's also important to know that these environmental factors can impact our endocrine system, especially if you're working with patients that have hormonal imbalance, women or men's health conditions. Here's an example. chronic lead exposure was reported in this study to overactivate the immune system and might increase the risk of developing an autoimmune condition, thyroid condition called Hashimoto. Hashimoto disease is the most common cause of hypothyroidism, and unfortunately, hormonal replacement therapy does not address the underlying inflammation or damage that is caused by those thyroid antibodies. So let's take a look at a few of the mechanisms of environmental chemicals. You can see here on the screen that you have cell metabolism that by itself can produce some chemicals or toxins. And then you have the toxicants on the bottom, which are the environmental chemicals, pollution, radiation, consuming certain medications that increase the amount of free radicals. And that contributes to oxidative stress, which means that there are now more harmful compounds like reactive oxygen species and not enough of the compound, the antioxidant compounds and other enzymes to prevent the damage from those free radicals. And those free radicals cause damage. They circulate between our cells. They steal electrons from nearby molecules, causing instability and eventually leading to damage to the cells and are associated with chronic and degenerative diseases. Oxidative stress, as I mentioned, plays a major part in the development of chronic and degenerative conditions such as cancer, autoimmune disorders, accelerated aging, cataract, rheumatoid arthritis, cardiovascular, and neurodegenerative conditions.